morning, good afternoon, and good evening to everyone on the call. As Berenice mentioned, my name is Roxana, and I'm very excited to be moderating this week's Global Cafe, which is particularly relevant and timely with this Sunday being World Hearing Day. So to discuss World Hearing Day 2024, changing mindsets about hearing loss and deafness, we have today with us an incredible speaker, Dr. Sue Archbold. So thank you very much, Sue, for taking part in these global cafes. It's lovely to have you here. And to familiarize everyone a little with Sue and as a little bit of her background, following a career as a teacher of the deaf, Sue Archbold managed Nottingham Cochlear Implant Program from its inception in 1989 until 2004. During this time, she published widely on family and educational outcomes from pediatric implantation, including cost-benefit analyses. As the CEO of the Ear Foundation, she led a team of research, education, and services for cochlear implant users of all ages and their families. Her PhD was on deaf education, changed by cochlear implantation, and she was honored with an Honors Doctor of Letter by Nottingham University for her work on cochlear implantation. Sue is now the coordinator of the Cochlear Implant International Community of Action, also known as CIICA, and remains passionate about improving access to the best possible services for all with deafness and hearing loss across the lifespan, and ensuring the users and family voice is heard. So it's incredible to have you here today, Sue. Thank you for everything you do. And I just really want to hand the floor over to you. We typically start off our global cafes by going through your bio, but I'd love to hear your story. And I know, oftentimes career choices are based on life experiences, personal interests, things that you've gone through. So what prompted you to go into the field of hearing health, including hearing health across the life course?
Thanks very much, Roxana, and thank you to everybody for joining us today, wherever you are. It's just early afternoon here in the UK, and it's a real pleasure to be with you. And I have enjoyed some of the other IFA conversations that I've been a privilege to join. Thanks for asking, Roxana, about my career choices. Imagine some of you may have had similar experiences when you look back over your life. It didn't feel like a career choice. It felt like something that was meant to happen as it kept going along. It didn't feel like I had my life planned out where I had my targets and goals. I did start life as teaching young children because I was fascinated by the development of literacy skills as a reader, passionate reader. That's so important. And two things happened. One, a friend had a deaf baby, and two, I had a deaf child come into my class. And when a friend had a deaf baby, it was a real eye-opener for me. I had thought about lack of communication if you're deaf. I hadn't thought about this baby being born without language in her head. We're not born with language in our heads. We develop language through interacting with our parents and carers. So you develop French or English or Polish or whatever. And there was this child who really cognitively was really challenged because of lack of language. So I became a teacher of the deaf. And then the first child in the UK to have a cochlear implant was a child in my class. And so there I went again. The next move came into cochlear implantation. And some of you may know that it was hugely controversial that was in the 1980s, a long time ago. It was hugely controversial. It was a really challenging time. There was no money, but as ever, a mother was, yes, and I'm sorry, gentlemen, it was a mother who got stuck in. She was determined that her child, who could now hear nothing after meningitis, with the strongest hearing aids, he heard nothing. And she'd heard about cochlear implants and in Australia. So she determined that he would have a cochlear implant. And there were a number of us in Nottingham, and it was one of those serendipity things. And a surgeon who had experience arrived from the States, from Los Angeles. And so we set up the first cochlear implant team amidst much opposition and raised the money and then convinced the government with the results that actually cochlear implants work better than we had ever imagined. And it took off from there. So it's been a privilege to be part of that development for the last 30 years, I suppose, which has passed very quickly when you look back, but are still busy. So thanks for asking about that. As I say, it was never part of my life's plan. It's how it's happened.
No, and that's a wonderful, I think, story. And I know now your current position is with CIICA, the Cochlear Implant International Community of Action. So can you tell us a little about CIICA, its purpose, how it even came about?
That's really helpful for a question. Thank you, Roxana. So, well, CIICA was set up exactly 3 years ago. And again, it was something that emerged. I was running a charity which was providing services for all ages, so not just children, right across the life course. So as hearing services, including adults, including older adults. Although I have to say, as I grow older, the definition of what's older changes and sort of moves on all the time. So we had adults coming to our services who had hearing aids, who had cochlear implants, and I did that for quite a long time. But we were frustrated about the lack of access both to all hearing technologies, the lack of take-up of hearing aids, but also the lack of take-up of cochlear implants. We estimate that only 1 in 20 of those who could benefit from a cochlear implant actually receives them. Only 1 in 20. And that's huge. And the effectiveness of cochlear implants has been proven. The cost effectiveness of cochlear implants has been proven, and still people weren't getting access to them. And even more importantly, in a way, they weren't getting access to the lifelong services for cochlear implants. Cochlear implants are used when hearing aids no longer provide somebody with useful hearing. So you're really almost completely deaf without it. And then with a cochlear implant, you have extremely useful hearing. Most people are able to hear extremely well. Many use the telephone and so on. So the lack of access to cochlear implants was what drove us. Excuse me. So a colleague and I, Brian Lamb, we did a global consultation of hearing groups, of professionals working with people with hearing loss, and of user groups, those with hearing loss, and also of groups like Age UK in the UK, working with older people. So we did a consultation about what they wanted to see happen about cochlear implants. And they told us what they didn't want. So they didn't want an organization. They didn't want bureaucracy. They wanted some action. So they wanted things to happen. And so we set up CIICA as a network. So we're a network. We're not an organization. A network of really the most amazing groups around the world. We're now got members in 66 countries. And it has just amazed us what people are doing, the grassroots work and the change that people are trying to make when they're aware of the importance of hearing loss and what we can do something about it today. So we have over 100 organizations, and we thought that it would be organizations that would join us. But in fact, we've got, I think as of today, it's about 560 individuals from 66 countries around the world. And I've met people who I never knew existed, who are passionate about doing something about hearing loss and affecting change. And some of their stories and achievements are just amazing. So CIICA today is 3 years old last Sunday, and we are grown and grown, and we provide CIICA conversations where you can come and join us, a small group for an hour at a time, a real conversation. Roxana, you're part of them sometimes.
I am. And I will say, when Sue says real conversations, there's no better word. Voice and meaningful engagement, that person-centered care approach is always very significantly highlighted. So thank you, Sue, for going through that. And I'm quite surprised. I mean, no, I'm not quite surprised, but I am quite interested to hear about what you would think some of the most surprising developments have come out from CIICA. So through CIICA over the past couple of years, with your organization, particularly again emphasizing that concept and aspect of voice and meaningful engagement and the nothing about us without us motto, what surprised you? What are some achievements over the past 3 years that you would love to share?
Thank you. Well, I think really I shouldn't share CIICA's achievements because it's the network's achievements, as you say, that they share in the conversation. So these CIICA conversations, we take a topic, and it might be person-centered care, it might be tinnitus and deafness, it might be the role of parents groups and so on. But as you said, Roxana, a key thing and a key message that these groups and individuals are driving forward is that idea of nothing about us without us. As cochlear implants are set in hospitals, in clinics, it's a surgical intervention initially, and it tends to be a bit of a medical model. And what I have really been amazed with is how people want to run with it themselves. I think people increasingly want to make their own decisions, want to be involved in their own care, whatever it is, and want to drive services on which they actually feel they're not getting. So we've done two things that I'm proud of, and then I will say about the network some amazing things that are happening. We've done a big study which was actually funded by the Social Sciences Foundation in Canada of over 1,000 cochlear implant users globally. These cochlear implant users were asked about the services that they got and what would they have liked. Because after cochlear implantation, in cochlear implantation, you have a surgically implanted device in your head permanently, and on the outside, you wear a processor, which is a bit like the hearing aids that I wear, which sends the signal to the internally implanted processor. So clearly, for life, you need services to support that. And they work so well that actually, if something stops or people don't have spare parts, then they can't go to work. They can't communicate anymore. They can't go to university. School is extremely difficult. So it's crucial that they have these services. And all too often, cochlear implant services only think about putting it in and not about the lifelong services. So when we did our studies of over 1,000 people, the two key things that came out were high satisfactions with cochlear implants. Great comments. Best thing I ever did. Opened up the world again to me. Took me out of my box of deafness. Lots of quotes. But, and what I've found in life, there's always a but, unfortunately. The but was lifelong services, lack of spare parts, lack of funding for spare parts that people just don't think about. So those are the issues that our advocacy groups are campaigning on. And for example, in Uganda, Eddie, who is one of our board and has a daughter with a cochlear implant, but is interested in all levels of hearing loss. So Eddie, in Uganda, the government waived taxes on all hearing technologies. So hearing aids, cochlear implants, whatever hearing technologies you need in Uganda, there's no tax to be paid. And if you say to Eddie, how did you manage that? Eddie just says, well, Sue, we marched on Kampala. So that's real advocacy in action, I think. And services in Slovenia, for example, in Slovenia, you can get an adult can have 2 implants, and we do have 2 ears, and we do know that 2 ears are better than 1. In Slovenia, adults can have 2 implants. You don't get that in the UK. You don't get that in Australia. You don't get that in the USA, but you'll get it in Slovenia entirely because of the work and the advocates going at them. And Roxana, you've met some of them on our conversations.
Absolutely. Well, I think advocacy in action is a great summary. It really just shows how much advocacy can really go a long way. And successful advocacy is really key, again, to expanding the access to cochlear implantation. So I also want to shed a little bit of light on the upcoming, but also first global conference on CIICA. What's the purpose of the conference and what makes this conference so different from the rest?
Well, I've just been to a huge cochlear implant conference, which was in very a lot about the medics, a lot about the surgical procedures, very, very little about the long-term care that people need, about the services that you need if you're implanted. If you're implanted as a young child, and you can be implanted in the first year of life today, and if you're implanted in the first year of life, then you actually grow up speaking. You learn, you acquire language through hearing, you acquire language with an accent. You could need 90 to 100 years of services for that device. And yet there was nothing about it. So I'm firmly saying, excuse me, can we think about the users of these devices? Can we think about their everyday life in communication? Because sometimes I say that cochlear implants work too well. If you're really reliant on a device for communication in everyday life, you are very vulnerable to if you have any problems. So to get back to your question about the conference, we of course started in the pandemic, which actually I think was quite a good thing looking back, because everything was online, people could join very easily. We all got more confident, haven't we? I'd never have believed I'd be sitting here 4 years ago doing this, and yeah, we've all got more confident. Anyway, we decided that it was about time our board met. We have a wonderful board of people globally, and so that we decided we'd have a conference. So it's in Brussels, which is where our legal home is, and we decided to call it Cochlear Implant Advocacy in Action. So we're delighted that Dr. Shelley Shadder, who leads the ear and hearing care for WHO, is kicking off our conference. We're delighted that IFA is going to contribute about hearing care in the elderly, or the older part of our population. And we're trying to make it accessible to all our advocates from all over. So our advocate groups can get together and really inspire each other about what they're doing. You know, Eddie can come and can share with his daughter, who is amazing, what she is doing. And so we'll have advocates for accessibility. Accessibility for people with hearing loss is dire everywhere, whatever level of hearing loss, it's just dire. We think about ramps and so on, but we don't think about accessibility for hearing loss. So that we talks about advocating for accessibility, advocating for good education for those with cochlear implants. The children need their devices looked after when they're in school. Pointless them having a cochlear implant and sitting in school without the right batteries in or the right leads. So we need to train teachers, advocating for employers to realize that somebody with a hearing loss, not just a cochlear implant, but with a hearing loss, can actually contribute to society, and advocating to expand access to hearing care to the elderly. So there will be real grassroots people sharing what they're doing and hopefully inspiring and exciting each other to even greater things. And a particularly exciting part of it is we've got a group of young adults with cochlear implants. These are young people who were implanted as babies and children and who are now in their 20s. They're the very first group who have ever lived, who have had that experience. So take their implants off, they hear nothing. put their implants on. Some of them are midwives, they're teachers, they're barristers, and they're functioning in the hearing world, as they say. We're the first generation of deaf people to go into the hearing world and fully participate. So they are launching their agenda for change, and believe me, this cochlear implants have given this lot a voice and they're determined to use it and to make sure that they have the services for the rest of their lives. So they will be there too. And I think, Roxana, you've seen the video they've made.
Yes, absolutely. And I think if anyone else is interested in having a little bit more information on the CIICA conference, the link is in the on the chat sideline. So I encourage
Okay.
folks at that. Now, Sue, I also just wanted to get your thoughts a little on the topic of hearing in later life. So can you speak a little about the social and emotional well-being aspects and impacts of hearing loss, and particularly its relevance as we really age?
Well, as somebody who is aging, it's become personally very relevant to me, I have to say. And the major problem about hearing loss and why we don't manage it well, and as a society we don't value it, it's an unseen disability, an unrecognized disability completely. Yet the majority of us will have some sort of hearing loss as we get older. And because it often happens quite slowly, people just don't realize. I'm sure you all hear, don't stop mumbling, you don't speak properly. They all mumble on the television these days and so on. People don't realize that they're actually losing their hearing. And in fact, hearing loss is the greatest cause of years lived with disability over the age of 70. So the greatest cause. It's linked to isolation. It's linked to cognitive decline. You can see how it happens, and I'm sure some of you have friends to whom you can see it happening. They stop participating in conversation because they misunderstand, because they're embarrassed about not understanding. You're not getting your cognitive stimulation from conversation. So it has a huge impact. And hearing loss in later working life leads to unemployment, underemployment, if people don't do something about it. So it is a huge issue. And WHO thinks globally that, excuse me, only 1 in 5 of people who need ear and hearing care actually access it. 1 in 5, that's all. So that's an amazing statistic, bearing in mind the huge impact that hearing loss has, and the fact that we can actually do something about it today, which isn't recognized by society.
Absolutely. Well, thank you very much. And I think it really just goes to show hearing loss is it's all about the person, their in and their place in society, and making sure that's adequately advocated for is so crucial, particularly for person-centered care. I have a lot of questions to kind of ask you, Sue, but I also see we have a few questions in the chat. So I
Yeah.
might push for that first. So the first question I see here is by Mr. Shmuel Gerushami, who is a weekly contributor. And his question to you is, what would you say is the role of community and authorities, particularly in improving hearing health care, and specifically looking at low socioeconomic groups of populations?
Thank you for the great question. And I'm involved in the World Health Organization, the World Hearing Forum, and the steering committee there. And we're very involved in making sure that ear and hearing care is addressed throughout the world globally, and services provided as fully as possible. If you do go onto the World Health Organization and you look up deafness, and I think we put one of the links in the chat room if we could, the World WHO, Yes, and you need to link into deafness in there. You will see a huge range of resources available to be used in low-income countries, tips and resources, because what we really need to do is to get the management of ear and hearing care into primary care, so into general practice, as we call it in the UK, but into primary care. And one of the things that WHO is also arguing for, if we're thinking about adults, is about hearing screening. Some of us are probably old enough to be screened for some things, but we're not often screened for our hearing. And screening for hearing and newborn screening is now being rolled out in many places around the world. The technology is there to do it. It's reasonably straightforward. Adult hearing screening, you can go on WHO's website and take a screen yourself. So there are certain things like that that can be done. There are also other things that can be done to protect our hearing. Something else that WHO is doing is called Make Listening Safe. Huge numbers of resources, because the world is a noisy place. And one of the major causes of deafness and exacerbating deafness as you get older as well is the impact of noise. Everybody going around having headphones on isn't really necessarily a good thing. Those of us who maybe went to pop concerts when we were younger, the noise, it has actually exacerbated hearing. So many things that have been done, and thinking about low-income countries, the resources are increasingly available to make sure that in low-income countries that much is done to look after ear and hearing care right throughout the life course. And it's World Hearing Day on Sunday, the 3rd of March. And if you go on the website again of WHO for World Hearing Day, you'll see all the activities that are taking place all over the world, and particularly in low and middle income countries, to make a difference for ear and hearing care and manage it well in today's world.
Well, thank you. Thank you very much, Sue. And we'll make sure to have all those links in the chat as well. The next question from Eileen. Eileen, would you like to unmute to pose your question?
Thank you very much. That's very good talk and presentation, and good luck with all your campaigning. I see your name is Archbold. I'm around Dublin in Ireland. We have a number of our relations with that surname spelt the same way as well. I think
yes,
I think we've just exchanged across the Irish Sea. I just have one quick question, if you don't mind. You mentioned tinnitus. Is there a positive correlation between tinnitus and eventual hearing loss? Because some statistics indicate that hearing loss has also had tinnitus. Is it a negative correlation there, or is there a positive?
Thank you for a great question, Eileen. And yes, I'm an Archbold from Northumberland in the UK, and spelt the same way, which is unusual. So tinnitus is a really complicated topic. If you go on our website, in the community members bit, there's a research updates where we put, and there's a whole research updates there about tinnitus. And we have CIICA conversations about tinnitus and cochlear implants and tinnitus and hearing loss. Often as people develop a hearing loss as they get older, then tinnitus comes along with it. I'm not going to say whether it's a positive or a negative correlation, because I don't think it's as straightforward as that. But tinnitus is a huge issue, which at the moment, there is still very little that can be done about it. Sometimes, so for a personal anecdote, my husband suffers badly from tinnitus. When he puts his hearing aids on, his tinnitus is not nearly so noticeable. Some people who have really bad tinnitus, and tinnitus can be so bad it drives people to suicide. This is not a topic to be minimized at all, and it really deserves more research going into it. But tinnitus, some people who've had cochlear implants say the tinnitus actually helps. Some people say it hasn't helped at all. But when you link tinnitus with hearing loss, it makes managing the hearing loss and fitting hearing aids more difficult. Because if you think about your hearing being tested, and you've got tinnitus going on in your ears at the same time, people say they don't know what is the beeps from the audiologist and what is the beeps from the tinnitus. So it actually complicates managing hearing loss, and being able to programming cochlear implants is highly sophisticated, and programming them with somebody with tinnitus is difficult. But getting back, Roxana, to your person-centered care, when you ask people with tinnitus if their audiologist asks if they've got tinnitus, very few of them say yes. So the audiologist typically gets all the technical stuff out and gets on with testing the hearing without asking about tinnitus. So I haven't answered your question, Eileen, but it's a really significant issue to talk about to raise when we're talking about hearing loss. And again, that's one of our advocacy roles, talking to audiologists, trying to encourage them to think about person-centered care and to think more holistically about the person sitting in front of them.
No, it completely does. And thank you very much, Eileen, for bringing that question up. Next, I see Dr. Cynthia Stewa, and you have 2 questions in the chat if you'd like to unmute to pose your questions.
Hi, Cynthia.
Hi. Thank you so much. This is just fascinating. Congratulations on your first international conference. That's very exciting.
Oh, we haven't had it yet, Cynthia.
Oh, I know, but you're in the planning.
We are. Thank you very much.
My first question is, I was just curious about the amount of pushback that you have overcome with the deaf community. Very aware. I worked in the vision rehab field for 24 years, but also dual sensory, the vision and hearing. Yeah. And I was also curious about, you did touch on, the other age-related issues that happen. And certainly for hearing impaired people, a vision problem, especially something like macular degeneration that loses your central vision, really exacerbates the ability to lip read and to, and I just wondered about if any research in terms of those with any different with cochlear implant in terms of adjustment to the comorbidity.
That's two really good questions, Cynthia, and interrupt me if I don't answer them correctly. So the first one was about the pushback from the deaf community. So that at the beginning, there was huge pushback from the deaf community. And of course, it was a very difficult time, I have to say, because I was a teacher of the deaf. And of course, we didn't have long-term results from cochlear implants. But all I could say was, as a teacher of the deaf, when the first child we implanted started babbling when they were switched on, I had never seen a deaf child babble before. Because you start babbling because you can hear. I'd never seen a totally deaf child. So we were fairly convinced that something was going on, and we tried to be extremely cautious. We monitored the children very carefully, etc., until we had enough security and enough results to be fairly confident, and to be even more confident now. But there was a great lack of, it was very difficult. And at the time, with parents of deaf children being accused of lots of things, outside our clinic was painted, "Death to those who kill our deaf children." And so it was very hard. So we spent a lot of time explaining cautiously how we were doing, explaining that actually the sounds through the cochlear implants were new, it was different, and so on. And so gradually now, though, these young people are speaking for themselves. And one of the things they talk very movingly about is that they would like more diversity in the deaf community. And they're highly articulate, this young lot. Their language levels are just amazing. So what they want to do in their agenda for change is to have broad representation of diversity and deafness, which actually makes sense in today's world, doesn't it? So good luck to them. So, and then your other question was, hang on,
the age
about vision and macular degeneration. Yes. Of course, there's a lot of comorbidities with deafness, as you know. If we think about children, up to about 40% of deaf children have another problem, which might be a language learning problem and so on. Interestingly, before cochlear implants, I taught children who I was sure had another language learning problem going on, but I couldn't identify it because I didn't know what was due to the deafness and what was due to the other cognitive problem. Whereas now, when they can hear, you can identify language learning problems in children. But if we think about adults and macular degeneration and so on, and interestingly, I have a neighbor who has a cochlear implant, and when she moved here, and I thought, you need a cochlear implant. Macular degeneration, husband with dementia, arthritis, what's on. So she now has a cochlear implant, and her sight, of course, is getting predictably worse. Her hearing is much better than her sight. So that's, I think, without her cochlear implant, she would be in a care home. She's maintained her independence. She can go to appointments, she can talk, yes, and communicate really well. So that's made a huge difference, and that's really interesting to see. But again, some of the industry, you can imagine, can't you? Some young scientist guy sitting in his lab, really excited about a new development, not at all thinking about my Rosemary, who's got arthritis and can't see. So they excitedly think that they've made the device smaller than ever. And actually for Rosemary, that's not the answer. So again, I'm always saying, excuse me. Yeah. So thanks for asking the question. It's really interesting. And I think you touched on cognitive decline as well. Yeah. More and more research. We've done a briefing paper on aging well, healthy aging. It's called Hearing Care, Cognitive Decline and Dementia. And in the Lancet there was a paper not so long ago saying so. Midlife hearing loss is the biggest modifiable factor for cognitive decline. That we all know our cognition sort of goes down like this. If you have a hearing loss, it goes down more quickly. If you manage it well with hearing aids or cochlear implants, then it's improved, and it has a certain validity about that, face validity about that, doesn't it? But if you can hear and your brain's being stimulated and you're participating in society and so on. Thank you.
Well,
thank you very much.
Thank you both very much for that. And that actually ties in very significantly with the next question in the chat from Mark Venning. So Mark, would you like to unmute to pose your question to Sue?
Yes, thanks, Sue. You kind of mentioned this already, but can you speak a little more to the correlation between hearing loss and the development of dementia? Because my mother had both issues, and it was rather challenging sometimes because she kept losing her hearing aids, and she didn't want to wear them, so I don't want these things. So can you speak a little bit more to that and what we can do about it?
Yeah, thank you for the question. Yes, it is so challenging. And I come back to this whole point of needing lifelong care for your hearing loss. It's pointless having hearing aids if they're in the drawer or you can't use them, so on. And again, I'm permanently, when I go to a conference, go up to the technology booths and say, and I get my hearing aids out. So here's my hearing aid. Okay, so tiny little thing and so on. 2, I haven't got arthritis yet, but to actually change the wax filter. At the moment, they're not working very well. And do you know why they're not working very well? Not because of the technology, but because I've got a development of wax and I cannot for the life of me change the wax filter. My husband, it is just so stupid. They tell me that they're changing it, but somebody like your mother, that's just a major issue. And I still don't understand why in today's world they can't make it so much easier to self-manage your hearing aids. I haven't really answered your question, but it's just one that frustrates me. And when I was running the charity, we did a lot of work with healthcare of the elderly in hospitals, because if you're in care, or if you're in a ward, I don't know whether is your mother still independent?
My mother passed away in 20.
Oh, I'm sorry.
Yeah.
Oh, I'm sorry. So
2007. But back then the technology was probably a little different, and it's almost 20 years ago, whatever, right?
Yeah, because I mean, the technology is brilliant now. You know, mine's all Bluetooth, the phone goes into it, the podcasts go into them. The sound is great when it works. They just don't, as I say, I think these young, I shouldn't be pejorative about the young, we need their, but I don't think they actually think about the practical. So one of the things about CIICA is what we're saying is users of these technologies should be the ones driving forward the research and should be the ones driving forward the designs. And it should be so that somebody, a busy young carer or old carer, a busy carer in a care home should be able very easily to ensure that the hearing aids are working. And that just isn't the case.
Yeah, they barely had time to even go in and check on her half the time. So,
absolutely. And I know when, to my eternal shame, when my mother was in hospital at the end of her days, there was so much going on that even I didn't fight for a hearing aids. We
kept buying new ones. And, what else can you do? Anyway, you've answered my question pretty much. Thank you.
But they're useless if they're not in. And you see so many people in care homes who aren't wearing their hearing aids. And the other thing I'll say, there's a great guy in London, a great young ENT guy, who did some surveys he went into care homes and tested hearing. And some people that they thought that they had dementia, guess what? They needed a hearing aid. When they had their hearing aid, they were brought back into the conversation in the world. So it can work both ways.
Well, thank you very much, Mark, for the question. And thank you, Sue. And I think just building off of that, how can we build those bridges, the interdisciplinary collaboration, people working in the care home, just different disciplines? How can we encourage that so the hearing folks are not just talking to the hearing folks and the other experts are not just talking to themselves, but instead it's more of a complementary collaboration to feed on what we're trying to achieve, which is person-centered care?
That's such an important question, and I think it's not only in the hearing field where that happens, is it? It's a typical thing, and it's even worse than you said. I've just been to this huge cochlear implant conference, so where people who know about cochlear implants talk to other people who know about cochlear implants, and so the people working with hearing aids, they don't have joined up conferences either. Believe it or not, it's just it's amazing. Well, I think if we started off with society in general, recognizing the impact of hearing loss is much bigger than anybody realizes. And we all need to just keep banging on about that. And we then also need to ensure that society realizes we can do something about it today. There's some great studies. There's the European Hearing Instrument Manufacturers Association, is called AHIMA, It doesn't just work in Europe, it does studies in the States and Japan and other places. They have amazing reports. Every year they do surveys of the population about how many people understand anything about hearing loss or about hearing aids and so on. And there are absolute revelation about how little the general population actually thinks about hearing and hearing loss. And so if we get society in general to think about it a bit more and to be aware of it, then things might be better. Maybe it is getting better. You do typically see more people wearing hearing aids now, don't you? Whereas before there was, there still is, I think, in many places, a certain stigma attached to hearing loss. Interestingly, WHO again did some videos of people in the street just videoing them. You know, what do you think about when you think about somebody with hearing loss? And the words that came up were shame, silence, stigma, stupid, awful words to do with hearing loss. We have to change that.
Yeah, and I think World Hearing Day is a great opportunity to also work to change that. It is around the corner, so I want to ask you, what initiatives can we all do to, whether, you know, whether we're directly affected by hearing loss or not, to raise this awareness and prevent hearing loss and promote ear and hearing care across the world?
Get your hearing tested yourself. Ask for your hearing to be tested. Ask for screening. Make a noise about doing that. Make people aware that that's an important thing to do. I think also we need to all be aware of the impact of noise. You know, don't be afraid if you're in a restaurant that's got appalling acoustic conditions and so on, you know, one of the bare walls, bare ceilings, and they've got noise, music going on. Don't be afraid to say, please, would you mind turning the music down? You know, I value my hearing. I want to hear what people are saying and so on. So let's just keep making a noise about how important hearing is, because communication is just a vital human ability. And unless you hear somebody else, then you're not going to, you have to hear somebody before you listen to them. And listening is part of a conversation.
Absolutely. And communication is central to hearing. And I think I encourage everyone on the call for World Hearing Day on this Sunday to just raise awareness and promote ear and hearing care. But we are slowly coming close to the end of the session. Before joining the call, Sue actually said it's very funny how fast these sessions go by, and this is no exception to that. But typically, Sue, prior to the end of the session, we ask for your key takeaways that you would like to share with us all, whether that's things you've learned from the discussions or just key takeaways that you'd like to share. And to allow you some time to gather your thoughts on some stuff to share, I would like to introduce our next week's topic and speaker. So next week, we have the opportunity to listen to Dr. Jane Carmody on the topic of inclusion of patients and caregivers in policy development. Dr. Jane Carmody is actually on the call today as well, so we're very looking forward to having you as an expert speaker next week, Jane. Well, thank you very much, Berenice, for sharing that. And back to you, Sue. What are...
Thanks. Well, I was just going to say to Jane, I'll try and be on the call, Jane, because what a great title, and about patients being involved in policy decisions, and that is, of course, part of what we're about. And actually, policymakers, in my experience, listen to the patients. We have, before I just do round up, in the UK, we have the National Institute of Care and Health Excellence, which decides what our National Health Service spends money on. It's actually key to, so when we had a cochlear implant technology review with them, it was very important to have the patient's view. And Jane, they have a section called Patients Involved in NICE, and the submissions from the patient groups were really key to them funding cochlear implants. The scientific committee even said that they saw statistics after statistics about decibels and hearing loss and so on. And then the patient voice rigorously presented just changed their views, because the impact on people's lives was really valued. So I look forward to Jane's talk next week. And I hope that if I've just done two things, make you think about your own hearing, make you think about the hearing of people around you, be aware of making things easier for communication for everybody that you're with, and to be aware of, just perhaps made you think more about the huge impact that hearing loss has at all stages of life, from babies right through to the elderly. And in that report that we did, the oldest people, who we had 8 people in their 90s who reported who had cochlear implants. So you're never too old to come to terms with the technology. You're never too old to be changed by the technology. And if it's difficult, we make a noise about it. Something can be done. So 2 things. One, the impact of hearing loss is just under-recognized by society, and we all need to do our bit about that, because it's part of who we are. And today we can do something about it. And if you're not offered those sort of services where you can do something about it, then go and make a noise about it, or email us at CIICA, and there'll be somebody who will help you make a noise as well. And please go on the website and perhaps see some of the interesting things that can be done. And for World Hearing Day, we need to change mindsets. That's their title, Changing Mindsets About Hearing Loss, to ensure ear and hearing care is for all, not just for the 1 in 5 who get it. And I think there's about 700 activities going on around the world on Sunday. Some of them are really exciting and innovative. Go and have a look at them on the website. And thank you all for all you do. I've enjoyed the conversations that I've been on too, and Roxana for all you do to make them happen. Thank you, everybody, and I look forward to next week's.
Thank you, Sue. Just a very big thank you for those final remarks and for your expertise today. Before we sign off, again, echoing Sue's comments, thank you everyone for joining. You make these sessions as incredible as they truly are. Thank you. Jane's session next week will be phenomenal, as Sue mentioned, so we look forward to having you there. And finally, a very big thank you to the IFA team to help run not only this cafe, but every other one as well, particularly Berenice Anaya. So a big thank you, and wishing everyone a very happy weekend.
Indeed.
Happy Hearing Day, everyone. Thank you.
Bye. Thanks, everybody. Take care. Take care. Look after your hearing.